And so I know some of the work that you do at Element and all of the Elements and all these other organizations you've been a part of, not just now, but kind of throughout your career, has worked with young adults, young people, college age. What do you see as the most common problems among college kids that you have addiction issues with?
So people's paths to addiction are different from one another. When you look at college age kids, they're often experimenting. There's a certain romanization of drug use, doing more is better, seeing how extreme you can get is better. So there are a lot of people who may have trouble with drugs who are not addicted because it's an age where people gravitate toward extremes. But the other thing that we see is that it's also an age where people are separating from the families they grew up in, and they may not be ready for the independence that they have. And so there's a lot of anxiety in being a young adult. You're on your own, you have to make your own decisions. There's a fear of being alone. Are you going to be accepted? Are you going to have a peer group? I think the attraction of clubs and societies and fraternities is this need to be part of something.
There's a lot of stress with different schoolwork and with being on your own.
Multiple responsibilities. And then, early adulthood is an age where many serious psychiatric disorders first rear their ugly head. So things like severe depression, bipolar disorder, schizophrenia, all these things start to turn on at that age, including drug addiction. And so I think that that adds another level of stress to people, because if you're fighting depression or you're fighting anxiety, that's going to put you at greater risk to use certain drugs. And we see that a lot at Promises.
So is that the connection between those kind of those behavioral disorder, being depressed, anxiety, and drug addiction? Is it's using to fight those kinds of things?
Yeah. So when you look at it, probably somewhere around a third of the people who become addicted have had problems with depression or anxiety or abuse before they ever used a drug. And we think that it's sort of a self-medicating theory of drug use that says those folks are drawn toward drugs because the alcohol or the drugs give them some sense of calm. They're trying to quell that anxiety. Opiates are very powerful anti-anxiety medicines, and probably half of all the young adults that we see with opiate problems had anxiety problems before they ever took them.